Ever wondered why some superheroes have special powers? Well, our bodies have tiny powerhouses called cells. But what happens when these cells get clogged up with a sticky, unwanted substance? Imagine a disease so rare that only 1 in 55,000 boys born will have it. But this rarity doesn't lessen its severity. This is Fabry disease, a genetic disorder that lurks in the shadows, often going unnoticed until it strikes at the heart. And when it does, it's not a gentle tap. It can cause heart attacks and heart failure. The disease primarily targets the kidneys, heart, peripheral nerves, and skin, with heart complications often being the most severe. It's a stealthy enemy, slowly accumulating harmful substances in various organs, particularly the heart. This accumulation can lead to restrictive cardiomyopathy, a condition that makes the heart less elastic and reduces its ability to pump blood. The rarity of Fabry disease doesn't make it any less serious. It's a silent threat to heart health, and we need to understand it better. Imagine your favorite video game character glitching because of a bug. Our bodies can glitch too, and Fabry's disease is one such glitch that affects the heart. Now, you might be wondering, what exactly is Fabry disease? Well, let's break it down. Picture your body as a city, and the cells as houses. Now, in a well-functioning city, waste is efficiently disposed of. However, in the case of Fabry disease, a genetic glitch causes waste to pile up in the houses or cells, leading to various problems. This disorder is caused by mutations in the GLA gene, which is like the city's waste management system. When this gene doesn't work correctly, a type of fat called glycosphingolipids builds up in the cells of various organs. It's like having trash bags pile up in your house. Not a pleasant situation, right? This accumulation primarily affects the kidneys, heart, peripheral nerves, and skin. But here's the kicker. It's not just a simple mess, it can lead to severe health complications. The heart, for instance, can suffer from arrhythmias and even heart failure. Imagine your city's power plant struggling to keep the lights on. That's what happens to your heart with Fabry disease. So, Fabry disease is like a bad house guest. It enters your body uninvited and starts causing chaos, especially in your heart. Feeling pain or tingling in your hands and feet. It might sound strange, but it could be a clue to a special kind of heart problem. Watch on to find out. How do we know if someone has Fabry disease? What are the signs and symptoms to look out for? Fabry disease, an X-linked genetic disorder, primarily affects the kidneys, heart, peripheral nerves, and skin. The symptoms can range from neuropathy and abdominal pain to more severe conditions such as renal failure, strokes, and heart complications like arrhythmias and heart failure. The disease can even present as a cardiac variant with left ventricular hypertrophy, a condition where the muscle wall of the heart's left ventricle becomes thickened. This is particularly concerning as it can lead to heart failure, arrhythmias, and even sudden death. Let's look at some numbers. Fabry disease is estimated to occur in 1 out of every 55,000 male births. However, it's important to note that females can also be carriers and may experience cardiac symptoms more prominently. Remember, early screening for cardiac involvement is crucial in managing Fabry disease. The benefits of treatment may decrease once cardiac fibrosis, a condition characterized by the thickening and scarring of the heart tissue, develops. It's important to know these signs and symptoms because early detection can make a big difference in managing the disease. Now that we know about Fabry disease and its effects on heart health, what's next? How do people with this disease survive and thrive? The answer lies in understanding the survival rate and managing the disease effectively. For many patients, the journey starts with enzyme replacement therapy, a treatment that essentially fills in the missing pieces that their bodies can't produce on their own. This therapy has been a game changer, offering hope and a chance at a normal life to those diagnosed with this condition. But despite the challenges, it's important to remember that having Fabry disease doesn't mean giving up on life's joys and possibilities. In fact, with the right treatment plan and a supportive healthcare team, individuals with Fabry disease can continue to lead fulfilling lives. They can go to school, have careers, start families, and do all the things that make life worthwhile. And that's why spreading awareness about this disease is so crucial. With the right knowledge and treatment, people with Fabry disease can lead fulfilling lives. This disease is rare, but its impact is real. By understanding it, we can better support those affected and contribute to ongoing research efforts, like share, comment, and subscribe.